Well, hello everybody and welcome to this webinar discussion hosted by the Open University on how we might charter a new path for social care and social work in England, raising skill levels and making careers more attractive and rewarding. My name's David Brindle. I'm a journalist with a long-standing interest in these matters at The Guardian, but I'm also now chair of a non-profit care provider employing almost 1,400 people. So I've got a double stake in these matters, and I'm really as keen as anyone to see the sector's workforce picture transformed as we emerge from the pandemic. We're here to discuss a new report from the OU entitled The Path Forward, which includes the findings of an exclusive survey of 500 leaders in social care and social work. We'll hear some of the detail of those findings in just a moment, but it will come as no surprise to you to hear that there's little confidence that the sector has all the workers and skills it thinks it needs in coming months and years. On the other hand, the COVID crisis has forced many in the sector to think very differently about how they work, to adapt and innovate, as teams have responded so magnificently to ensure the safety and well-being of vulnerable people over the tumultuous past 12 months. We'll consider what we should save and continue from such innovation. And for once, I think we can be confident in saying some things will never be the same again. With me to pore over the survey findings and the recommendations of the report, I'm pleased to welcome Professor Samantha Barron, Head of School for Health, Wellbeing and Social Care at the OU, Simon Blackburn, who's Chief Executive of the Registered Care Providers Association in Somerset, and also an Associate Lecturer with the OU across a range of health and social care undergraduate modules, and Becky Squires, Principal Social Worker at Cumbria County Council. Becky has 30 years experience in the job and is also a practicing approved mental health professional. We're going to tackle this in three chunks. We're first going to hear a brief summary of the survey findings from Samantha with responses from Simon and Becky. Then Samantha's going to set out also briefly the recommendations of the report, again with responses from Simon and Becky. And finally, we'll talk a little bit about what the OU can offer to address these issues, and we'll take some questions and concluding remarks. I'm sure we'll have no trouble filling our allotted 60 minutes, so without any further introduction, let's get straight into those survey findings. Samantha.
Okay, thank you very much, David, and hello to everybody, and thank you very much for joining us all today. First of all, we commissioned this survey largely because we wanted to know what the pressures were for social care and social work going through the COVID pandemic, because we were getting informal messages, obviously, about that actually we're in the peak of something that was unprecedented, and we wanted to know the direct experience that people were having. And what we found overall is some of the things that David's alluded to, that actually the pandemic has tested the sector. And it's tested the sector, but actually exposed quite a lot of the key issues that were already evident within the sector. And those largely fall within two areas. One is around inequality of funding, and secondly, there's about a lack of a coherent plan for social care and social work, about the future for social work and social care, and in particular workforce needs. So that was generally the two key findings. Some of the statistics around that were actually proved very interesting. So what we found, key statistics were that nearly half of the organisations, over 500 organisations, are operating below the minimum skills required, and obviously had concerns arising from that. 67% of those organisations said they'd had to change their working practices very quickly in order to react and respond to the COVID pandemic. And also 44% of those 500 organisations had begun to change their recruitment processes and began to think about what skills do we need to get through the pandemic, but what skills do we need to begin to future-proof around adaptability for future challenges. What was interesting is when we delved further into those statistics around skills, is that there is clearly a skill gap in the sector, which we probably all know at this moment in time. What our 500 organisations told us, 67 said that their skills deficit lay in 4 key areas. First one was leadership, that actually wanted more focus on skill development around leadership. The second one was around digital ability and technological ability, because people were moving to technological forms of practice, and how do we facilitate that? The third one was around technical skills, so 31% of our respondents said that there was a skills gap around technical skills. And this is where it did begin to be a little bit COVID specific. In relation to those technical skills was seen to be around long-term care, and there was seen to be technical skills around knowledge and skill development that was around longer-term care planning needs, and that could be anything from understanding a little bit more about dementia, but actually also knowing different forms of medication. So we got quite a different feedback at that point. And then the fourth area was around managerial ability, and 30% of our survey said that actually we want, as a skills gap, is around our management capacity and our management ability. That was some of the statistics. What we also found overwhelmingly was that most respondents said that we really lack a defined and established career structure to support the workforce and to make social care a career in its own right. And that's probably very well known and has been very well known for years and years and years. So it was kind of heartwarming in the sense that people still think that, but also disappointing that actually we are still saying we do need a plan for social care around our workforce and planning. We also found that Brexit proved quite a concern for people. So 54% of our survey was saying that they're really worried about the impact that Brexit will have on the recruitment and retention for staff. And 54%, so the same statistic again, were very worried that this year they expect to have significant turnover of staff beyond the usual turnover, and they think that's going to be a post-pandemic experience for care providers. We also asked our survey about what concerns would they have post-pandemic. So once we begin to get through the more difficult areas, actually what will care providers' concerns be? 54% said it was a skills gap, that will remain. 51% that said so over half said they expect to replenish their teams with staff. They expect the turnover to be so significant that they will be on huge recruitment and retention drives. And just over half again, 56% said of those staff that stay, they still have concerns around retention. How do we retain staff after the pandemic? And what does that mean in terms of their future services and future careers? What's really interesting, a couple of really interesting statistics came forward on this, which is that 38% were saying that in that recruitment process post-pandemic, they want to make sure that recruitment is localised. And that actually then links to a recommendation, which we will talk about a bit later, but actually care providers wanting localised services. And that is a distinct difference between social care and healthcare providers. So 38% were saying they wanted to actually attract from local areas and have a localised service. 40% want to increase diversity beyond where they currently are. So again, another interesting fact. So what we're beginning to find is some interesting bits of statistics around how COVID's impacting. So 67% have actually changed their working practices. We've got an idea of what the detail is around the skills gap, but we're also finding that those long-term systematic issues still remain in social care. The lack of a social care plan, lack of investment, a lack of a career progression framework. Thank you.
Thank you, Samantha. Fascinating stuff. We'll come on for some reflections from Simon, but just before we do, let me just press you a little bit on the point about the technical skills gap that you found, and you mentioned people saying, well, it was things like dementia, working with dementia, working with medication. Is that in your view because people have found themselves through the pandemic working above at a higher level than they were before, doing things which weren't expected of them before?
Yeah, I'm not sure whether it's at a higher level, but they were being asked to do different things. And so what we found is that the technical skills, when you break it down in the report, border on health related skills. So so actually care workers were then beginning to think about, do I have to move into some health related skill development work? What we don't know from the report is whether that's largely because, for example, in some of the care home situations, they became closed environments and had restricted access. So we don't know enough about it, but we do know that health-related skills were being brought into social care and people were acting on them.
Excellent, thank you. I'm sure this crossover of health and social care is going to be an issue we'll come back to time and again in this conversation. Let's go to Simon. Simon, what are your reflections on those findings from both from your perspective as a representing care providers, but also with your wearing your academic hat?
Thanks, David. I think the findings are timely. In a way, I agree with Sam that there are no surprises, but I think what it does is reiterate the kind of the ongoing crisis that we're facing through years of underinvestment. Ultimately, that hits the front line, which is why we're talking about workforce, because that I think ultimately that's where it hits hardest. And I think it's timely because COVID-19 has really brought into focus the long-term impact of government investment, lack of investment. So what we're seeing is a real limited resilience and limited capacity of the sector to have been able to respond effectively to the pandemic. And it's an interesting point about management, being picked of additional skills not being there, because what this has led to has been the inability for provider organisations to build in effective middle management. So lots and lots of frontline workers and senior managers, and nothing in between, because there's no funding to sustain that, and which is why there's no succession. And there's no progression or succession planning within these organisations because of the lack of that investment. So I think that's what we're seeing. The other thing is that I do really think that COVID-19 has sped up the journey we're on to the transformation of social care commissioning. So we are now seeing, a disinvestment in care homes, which has been sped up by the pandemic. Homes are struggling with cash flow and financial resilience, really, and they really are facing, existential decisions about whether they can continue or not. We're actually at that point at the moment, and we're also seeing an aspiration for local authorities to start commissioning new models, which has in a way been put on hold because of the pandemic. But new models, and I'll probably talk about this later when we come on to recommendations, but new models are going to need a new kind of workforce. So again, this is timely for that reason as well.
Simon, we've talked previously about the decline and shrinkage of the residential sector, and it's never happened, and we're still being on or around 400,000 beds in England. Do you think this time this is such a significant impact on the sector that we are going to see that change?
I think certainly I'm speaking for Somerset, but I know my colleagues across the country are saying the same thing, that we're now seeing void levels going up by 15%. So people are operating their care homes on 70, 80% capacity, which long term is unsustainable. There is a desire for homes to be recommissioned to provide different levels of care, more complex need, more specialism. So I think there will be an increasing and growing demand for those kinds of care homes. But I do think that we're seeing a transformation of that sector as well, with fewer care homes being commissioned for standard beds.
So on both fronts, really, there'll be a need for new and different skills, whether it's care being provided in alternative ways, or more intensive care being still provided in a residential setting?
We're going to see that, David. And I think one really important point is that the transactional relationship between commissioners and primarily private sector providers is such that we've created a workforce that can, for whom the jobs they're doing suits their lifestyle. So, flexible contracts, 0-hour contracts suit a certain person. If it didn't, they wouldn't be in the sector. They're the kinds of people who won't necessarily be interested in long-term career choices, salaried roles, full-time employment. So we need to be looking to a new workforce who is choosing care as a career, as Sam said, who want to go in there in the long term. They can see opportunities of progression, and providers can build in succession planning with people they know are going to be with them for a long time. So we are, I think, ultimately talking about a different workforce. Big challenge.
Excellent. Let's hear from Becky. Becky, before you reflect on the findings, just describe for us, give us a couple of minutes on what it's been like working through the pandemic at the sharp end. How different has it been?
Well, thank you, David, and thanks to everybody for the opportunity to be here today. I think in many ways, working over the last year has been it's been incredibly challenging for our staff who are social workers, social care staff, and our occupational therapy staff as well, who are working in social care. It's been a real challenge for us to remain person-centred in our assessment work and in the delivery of care that we have. We're particularly challenged by living and working in a rural county. So I think Samantha's points earlier about that local delivery is something I'm particularly interested to talk about a bit later on. We've really been thrown into using technology in ways that I think we'd hardly considered before this, before the pandemic. So as well as kind of supporting each other and trying to maintain those supportive professional relationships and people's emotional resilience, because things have been so difficult for everyone. We've been trying to support people to find new and creative ways to fulfil our statutory responsibilities.
Can you give us an example of the way, just from perhaps some day-to-day practice of how people have adapted? Is there anything that springs to mind?
So I think the one that comes to mind most obviously is the difference between working face-to-face with people and working over technology. So that's different sorts of things, like Zoom and these type of things. That really poses challenges for social workers and occupational therapists in particular, particularly when we're thinking about people who may have challenges around their mental capacity and all of the information that we gather during an assessment and during other types of visits as well, where we're not just taking into account what the person is saying to us verbally, but we're needing to triangulate that with evidence around the person's environment, and of course assessments are not just a one-off piece of work. Social work and social care for me is very much about that. Is about establishing and maintaining a relationship. That's the best foundation for work that for the person with care experience is going to make the most positive difference.
There's been some controversy, hasn't there, about mental health act assessments on Zoom.
There has.
I'm inferring that you're not very comfortable with that.
I think that it's really challenging, and obviously setting aside the Devon judgment for a moment, I think what I've been saying to our staff is that we absolutely need to be thinking about this on a case-by-case basis, and professional judgment is absolutely the key for that. I'm a real firm believer in the value of relationship-based practice, and I would say that social work and social care, it's just not possible to create an algorithm for that.
Simon, you're nodding. I'm taking it. You very much agree with that.
Absolutely, yeah. I mean, I think relationship-based social work, social care at the moment it's very difficult to sustain and deliver, just because of the tightening of belts and resources, but also I suppose the technical rational approach to delivering a public service, rather than a relationship-based social work. Yeah.
And Samantha?
Yeah, I agree with that actually. I think when you think about the point in which we work with people or intervene, it's often at a point of high vulnerability or crisis, and therefore it's fundamentally important that you develop a relationship with that person and have the knowledge and skills to support that development. I think there has been a trend in social care and social work around this technical, rational approach to skill development that is bringing artificial intelligence and algorithms, assuming that you can predict human behaviour, and actually you can't. Human behaviour is complex, and that's the richness of human behaviour, the complexity of it. And actually it's only through relationships that we understand human behaviour and can bring about change.
So, Samantha, Simon mentioned one of his points was about this middle management gap, and saying, we've got people at the top and we've got a lot of people on the front line, but we haven't got that cadre in the middle, and therefore we're lacking this career structure. How do I mean, we'll come on to recommendations in just a moment, but how does that impact on organisations, and B, how do we set about redressing that?
Yeah, I think the big impact is that you have very senior managers at strategic level, and you are setting strategic direction and visions, but actually middle managers are often the point between the operational and the strategic, and that's the bit that can be missing, because that leadership at a middle management level is about supporting actually frontline workers to become good practitioners, and secondly to support that interface between the operational and the strategic of where the organisation wants to go and why it's going. I think there's been a huge historical lack of underinvestment in that level of worker, both in social care and social work, because both those areas of practice are still quite new compared to other occupations and professions, and have never had the national recognition that comes with the investment that you would get around that. What we've got and what we've historically had is actually new managerialism coming in. So we've had an increase in non-practitioners moving into management positions, often as a management perspective, which is one way of doing it, but it's not always successful.
Becky, am I right to think that you're a principal social worker, which is a relatively new breed. Was that am I right to think that was an attempt to fill that gap and keep practitioners, as it were, at the front line?
Yes, I think so. I think for me the principal social work role is works best when it's fairly knitted in, if you like, to the infrastructure of organisations in terms of actual practice and delivery. But it needs to kind of maintain a role that sits slightly outside of traditional management structures, if you like, and almost be a sort of a critical friend or a bit of a conscience, that type of thing, because it's about best practice, it's about excellent practice, and about governance. And sometimes I think without that voice, there's a risk that local authorities and organisations will unfortunately be focused on the more transactional aspects of social work and social care, and the financial costs and the burdens of having to manage finite budgets. That's the reality for local authorities.
And Simon, if people are going to be attracted into those middle management roles and to stay there, then they're going to have to be rewarded, aren't they? And we've seen the impact of the minimum national living wage has been to squeeze pay differentials, so that there's now the incentives are much less for people to seek a move up, are they not, in care organisations?
Absolutely, yeah, you're right there. That has been a negative impact of national living wage, as much as I would support it. Providers over the last 10, 15 years have been stripped of their capacity and their flexibility to, pay higher salaries for middle management. The money's just not there. It's impossible. They've been stripped to the bone.
Okay, let's move on to our second chunk of the session, and this is on the recommendations from the OU report. So it's back to Samantha to give us an overview.
Okay, thank you very much, David. So the report really gave 5 clear recommendations, some again which are new, some of which are a little bit more specific to this report. So the first recommendation was to establish a national career framework that clarifies national roles, national pay structures, that possibly looks towards developing a professional association for social care, or possibly opens the debate about regulation, which seems to be a bit of a on-off debate. The second recommendation we had was to develop a national social care plan that focused on recruitment and retention of the workforce, so that there was a plan in place. Just as quite often we have an NHS plan, we've had a number of those in the last few years, but we've never actually had a social care plan. Those 2 recommendations came out of some of the findings where 59% of our respondents were saying that COVID was definitely a catalyst to actually highlight the deficits in social care and social work, and that 40% of our respondents were saying that they clearly felt there was a need for sustained funding, and that's now actually gathering quite a wider momentum around different social care stakeholders. Our third recommendation was about targeting the skills gap and actually being very clear and very targeted about where that deficit was and how we could actually respond to that deficit, some of which we've mentioned earlier in the webinar. And our fourth one was to promote social care as a new localised service. And this is quite an important one for social care and social work, in the respect that actually most people who work in social care and social work have experience, to a greater or lesser degree, of social work and social care. And that's often quite a motivator to come into these jobs, and therefore they are often locally people who want to work local. And what's really important for us in social care and social work about that is that those people form part of the communities that we are working with. So it becomes a cycle of actually where people have had that experience, come to work in the sector, actually then live in communities that we work with. So there is more investment, there's more emotional investment, and it keeps the service local, which is often, I think, quite a distinction between what would be social care and what would be health care, which often has a much greater national perspective on it all. So that was our fourth area, and quite an important one, I think. And then the last one was about long-term financial stability and actually having that investment. But I think a number of people have been talking about that for years and years and years and years. And in fact, it was the current government's manifesto commitment, and we are still waiting for that. A couple of interesting statistics that came out around some of those recommendations was that 39% of respondents wanted to have a more constructive relationship between the private, public and voluntary sector. I thought that was quite an interesting statistic, and I think it's worth doing a bit more work around that, actually, because what do people want by them being constructive? Because the implication implies that it's not being constructive, and therefore what the barriers been. And I think Simon mentioned earlier some of the commissioning barriers that have existed, and the fact that the pay is not there because of the commissioning structures around that. The other interesting statistic around our future and recommendations was that 31% of our respondents wanted closer and continued integration with health. Now, we didn't explore that in depth, but again, that's an interesting statistic worth thinking about again, because for over 30 years there has been legislation, policy initiatives, organisational drives around integration. Sometimes we feel we're there, sometimes we feel we're not there. I very strongly believe in integration, and in fact I sit on an integrated care partnership board in the North West. Do we really know what we're integrating? Do we really know where we're going? We know what we want the outcomes to be for people. How we're going to get there is never quite settled. So again, I think that is something that's interesting. And for me, one of the interesting points is that if we're going to move towards integration, where does social care and social work sit within that? We've got some really good examples of where it's worked really well, but we've also got some unhappy examples for social care and social work. So one of the things I have said in previous forums is, why don't we think about a national care service, actually? So instead of moving towards integration, are we at a point where we want to develop a national care service, and what would that look like? Because there's this idea that if we integrate, that actually will become part of the NHS. Well, the NHS isn't that integrated. That's my experience when I work in the NHS. It's not as integrated as we tend to think it would be. So this would be adding something. It's now the time to say, shall we have a national care service? And where would we go?
Thank you. Isn't there a contradiction at first sight between saying we want a national plan, a national career structure, and your own view, potentially a national care service, and then saying, but we want it to stay localised?
Yeah, I think there is, but I think the localised element is definitely the delivery, and how we organise and commission that delivery. I think we currently have what I would call regional career frameworks or regional pay agreements. So I think we need to do both. I think we need to put social care and social work on a standing, and that standing has to have some national investment around career frameworks, pay structures, professional association, part of a regulator, but that actually our delivery should be localised.
Okay. Might come back to that. Simon, some reflections on the recommendations as Sam has outlined them.
Thanks, David. Thanks, Sam, for that. I am going to go on about money, actually. I think fundamentally an effective workforce is underpinned by a sustainable social care financial settlement. But before I go on about that, I am curious about the degree to which COVID-19 has brought on the need for us to work far more collaboratively through meetings like this. My organisation has never been so linked in with our local health and social care colleagues as it has now. So I suppose I do acknowledge that we can work better together without there being more money around. And so I am curious about that. However, my hobby horse is the one, I prefer to go on about now, which is, that there is a fundamental need to sufficiently fund the system. And there are two sides to that, which might answer your question, David, about a contradiction. On the one side, we need to have organisations like the Open University, developing opportunities for learning and development, career progression, career pathways. But when those people come out of their training, they're going to be looking for local jobs. And I've just pointed out that the kinds of jobs that are around for them at the moment aren't looking particularly attractive. They're not going to be people wanting to come out looking for, I hate this phrase, but casual labour. And I don't mean to criticise the workforce who are doing the job at the moment, but there will be people looking for long-term careers in social care. And within the independent and the voluntary sector, there aren't many of those about particularly. So it's down to commissioners at the local level to start commissioning in a way which allows providers to salary their staff on long-term contracts. At the moment, we're in a spot purchase world where they purchase individual packages of care for one person at a time. That needs to change. And we've had block contracts and all sorts of localized commissioning initiatives in the past. We need to go back to those and think about how we can harness them more effectively to deliver those that solid underpinning for the sector, so that they can salary staff who are going to be coming out of the likes of the Open University looking for work. And of course, there's a healthy codependence there, isn't there? Because once providers can afford to pay middle managers, they're going to want to access the Open University and other universities to further their progression and career development through the opportunities that are on offer. So I think that there's a healthy reciprocity which is on offer that we need to grasp.
Simon, how would your members in your care providers in Somerset respond to Sam's suggestion of a national care service?
I think that, it's a long-term vision, isn't it? Right now, they, excuse the phrase, but they're struggling to keep bums on seats. Something needs to happen far quicker than that to save the sector as it is at the moment. If a national care, what did you call it again, Sam?
I called it a national care service.
Yeah, the benefits of a national care service is that it does put value into the function and the role that people choose to take. It elevates the standing of social care as a job, as a career in our society. I know that in England, in Scotland and Wales, there is a regulation of the social care workforce, which I hear is giving some benefit in that direction. So I think they would support it, David, but there's also a crisis that needs to be addressed tomorrow.
Yes, of course. You referencing Scotland, the Scottish Independent Review, which came out a couple of weeks ago, proposing a national care service, but it was a very different interpretation to that which we'd been kicking around in England before, which I think in some quarters was seen as nationalisation of care providers. But in Scotland, they've not, they're talking about it quite differently, about it being a national, almost commissioning organisation. So I think it's in the eye of the beholder.
Yeah, I'm sure. I can't see that happening here.
Becky, what are your reflections on Sam's recommendations?
Well, I think I really, really welcome the debate, because many of the things that we're talking about, they're not new things, and I think, Sam, you're right to say at the beginning that in some ways the report is not sort of illustrating brand new findings, but it's absolutely confirming many things that those of us working in the profession have thought or felt or seen for a number of years, and it's really great to have those confirmed. I think probably the debate that we've just been hearing, and the level of complexity and the different nuances and views within it, for me that just kind of illustrates the complexity of the breadth of social care and social work, because we're talking about people, aren't we, and the kind of myriad different ways in which people live their lives. I think for me, any reimagining of social care and social work really needs to start with the experience of people who have experience of care, people with lived experience, and we need to really try and build our care delivery, if you like, and our delivery of social work around what it is that people want, what really is going to make the best positive difference in people's lives. I really welcome some thoughts around the kind of the spectrum that there is and the overlap between social care and social work. For me, living and working in a large, very rural county, the challenges around the digital technology and also local provisioning, they're really, really relevant for me. We aren't part of a big metropolitan area where we've got people moving around within the workforce. Our focus is very much on supporting local delivery of care to people with local people who work there. So I think anything that develops the support of people around that kind of lifelong learning and those that development of skills, flexible opportunities for people. Women make up a huge number of the workforce, but other people too have different caring responsibilities. So there needs to be not just one approach. There needs to be like a multiplicity of approaches in, so that we can support as many people as possible. And clearly, we all need to live. We've all got financial commitments. As Simon says, that needs to be realistic and sustainable financially for local authorities and for care providers, but for every individual who's involved in that system. Digital technology. Sorry.
No, I was going to ask you. I think Sam. One of the points Sam made was around having a professional association and or regulator, and of course we're having regulation coming in for social care in the other countries of the United Kingdom, not England, and we've had a professional association for social work in England, which was very short-lived. Would you favour that?
I think I absolutely would. I think it's there's something beyond regulation is really important, because that's about quality standards and making sure that people who are receiving care services and experiencing care services are getting the right level and the right quality of care. So that's absolutely important. But I think for me there's something about the importance of people working in social care and in social work, in feeling proud of that, feeling supported in that, seeing opportunities within that for lifelong learning and professional development, and that being something sustainable, so that it's so that we do have that consistency and that ability to meet needs in rural areas as well as more urban areas. So absolutely, yes, I would welcome that debate.
Simon, would you welcome a professional association for the sector?
I think so. I mean, I'm not a trained social worker. I can see the benefits of it. I know there's some research I saw some time ago now which suggested that professionalising carers undermine their confidence in in the skills they brought to the job naturally or through their relationships with people. I suppose the human drive to care for others is something that I would argue that we have as a species, and professionalisation, the research was suggesting, undermine people's confidence that they were able to do a job if they weren't doing it according to regulated, matrix of requirements, that kind of thing. But that's a kind of uninformed position, really.
Sam, do you recognise that risk?
I do, absolutely, actually, and I think that's part of the debate, actually, and totally agree with you, Simon, because the minute you move towards a professional association, use that word professionalisation, then actually you create distance between you and the person that you're supporting. That's quite a common experience, actually. So it's about, can a professional association be there as an empowerer and a facilitator of learning and knowledge? Because in the social care and social work field, we are at times quite disparate, because we've got many different types of stakeholders in social care and social work, which makes coordination quite difficult, and it can make working together quite difficult with often quite competing priorities. So if we had a professional association that just said this is good practice, or this is what we've learnt, or becomes a central point where we can share what practice is, help develop what practice is. Some professional associations go down the route of then setting standards that people are then inspected against. And that's the bit that we perhaps wouldn't want at this stage. It's more about learning and taking that learning into the front line, actually.
But regulation, Sam, which is slightly separate, you're very much in favour of that happening in England following Scotland, Wales and Northern Ireland.
Well, I think regulation is quite a tricky thing for social care. And there's been the debates in England about whether we regulate social care, and that was around for the College of Social Work, it's around for HCPC, it's now around for Social Work England. But if you look at the other regulators, if you look at NISC, Northern Ireland Social Care, they actually register, not regulate, but they register social care workers, and 73% of employers in their recent annual report are saying that they really benefit from that registration process, because it begins to raise the profile, and then it begins to say you have an opportunity to learn, you have an opportunity to go and do this course, you have an opportunity to develop yourself further as a care worker, and I think that's a good thing.
Mm-hmm. Becky made the point about, working in social care, and goodness knows, 1.5 million people do, more than in the NHS, but you wouldn't necessarily know that for the profile the sector has. How can we build the profile? How can we make the job more respected? Simon, what do you think?
How can we make it more respected? I think these are all potential solutions. So a better funding base, consideration of a professional workforce, or some way of enhancing care as a career choice. These things are all going to be helpful. I think we need to bear in mind that our mixed economy of care has produced thousands of independent care and support providers, some of whom are regulated by CQC, many of whom aren't. I'm talking about organisations that provide supported living. Not all those are regulated by CQC. We've got a growth also of what we're calling micro providers, but these are individual people who maybe have left social work or nursing or not, and have setting themselves up as providers of support and care, who aren't regulated either, because they slip through the regulations, not deliberately, but they do. So there are lots of choices there for people, and I wouldn't actually, personally, I don't know what my member organisations would feel, so I'm not speaking on their behalf, but I wouldn't necessarily welcome a universal framework for regulating or defining the workforce across all of those different providers. So beyond what we've talked about, David, I think we've covered actually in those maybe 3 different areas where we could raise the value of the workforce, but it is very disparate. And don't forget, individual providers have their own governance structures, their own priorities, their own frameworks for training up their staff and valuing them. And we're not in the place where we can or want to take that away. As you say, we're not going to have a national social care workforce employed by, well, that's scary thought, isn't it? Employed by who? But I don't think we're going to have that. We're going to remain with a mixed economy of care, and I think we have to swallow the downsides of that if that's what we want.
Yeah. Okay, let's move into the final part of our session, and let's just ask Sam just to sketch out what the OU offers to address some of these issues. Sam.
So in terms of the OU, what we want to do really, obviously the OU tend to think, people think of the OU as a distance online provider who provides a range of education options. But actually, fundamentally, what we want to do for social care and social work is to support social care and social work providers. And we want to do that by establishing long-term partnerships, because too often we, in the sector for social care and social work, we're stuck by quick fixes, which are often attached to ring-fenced amounts of funding, actually. And therefore we get ring-fenced funding for either CPD for to retain our workforce, or to actually recruit different types of workers. So as an educational provider, we get spot contracts around CPD, or we get student numbers. What we would like to do is to develop long-term partnerships with employers, actually, that moves beyond just student number relationships, and moves to support an employer or a number of employers on a long-term basis in a partnership approach around workforce recruitment and retention and all that takes. And what we'd like to do at the OU is bring to that our research capacity as well, and our research vision. And because quite often care providers will be saying, okay, well, as we've just found, 31% lack technical skills. We could be working with a care provider that says, we think this is in the area of dementia. Can we work together in a partnership to draw down some funding from a research and from a practice perspective about what we need to do to fill that gap? And it's those kind of things about trying to do that long term. So that's generally how we want to approach working with to support social care and social work providers around workforce. We also have a range of opportunities at the OU, which, having started at the OU 6 months ago, has been quite a revelation to me, actually. So the Open University has a core mission, which is about being open to ideas, places and people and methods. And as part of that, fundamentally believes it's driving knowledge to make knowledge free. So it has something called Open Learn. And Open Learn is an open resource for people to use and to gain knowledge and to gain skills. And some of those resources, I think, for example, could be used in induction processes for social care quite clearly, and they can be built into. We're also exploring at the moment in the OU with Department of Education the use of higher technical qualifications, and where do HTQs sit alongside apprenticeships that we currently offer in nursing and social work. We'd like to work with the social care providers and organisations to say, well, where would you put a higher technical qualification? Where does that boundary sit with an apprenticeship that is on offer, and how do we then support you in that? So we're kind of interested in that continuum. We have a range of modules out there around death and dying, around an introduction to health and social care, so beginning to understand what health and social care means, and then beginning to specialise in some areas health and social care. And at the OU, students can come and do Open Learn, which is free. They can just do that as a member of the public. They can come and study a module, which Simon will talk about in a bit more detail, or they can come and do a professional award with us, and they can go through and to become a nurse or a social worker. They can also do a certificate in care, a degree in health and social care, which doesn't have a professional body regulation attached to it, or they can go and do a PhD. So we kind of have the full range.
Simon, Sam has queued you up, but you do have a unique perspective here, both as a representative of care providers working with them, but also an OU lecturer. So what is distinctive about the OU offer in your view?
Well, yeah, good question. I mean, I've not worked for many universities, and only ever as an associate, really. So, but you're right, I'm a kind of frontline worker, really, for the Open University. In my two jobs, I see the real value of learning and development opportunities for frontline staff in the sector. And I think because of the way the university structures its access and its pathways and its modules, and I'm sure it's very similar to other universities, but the OU is what I know. I think what I've realised is that students rub up, even though it's all online, they rub up against, so someone doing an entry-level module in health and social care that I teach on will be working and rubbing up alongside people on social work pathways, nursing pathways, people doing open degrees, health and social care degrees, and through their conversations with those other students, the whole the whole environment opens up. They can see very visibly what progression is open to them, where they can go, and actually that it's achievable. The modular model, I think, works really well at the Open University, because, as Sam says, people can also come in through Open Learn and have exposure to health and social care topic subject matter there, and then they can start a module, not having to decide right then where they're going next, but they can manage their progression in dialogue with the support services within the Open University. So I think as part of this solution to the mess we're in the social care sector, creating opportunities for a new workforce is going to be absolutely key and fundamental, both in attracting people, but also training people up and sending them back out into the new social care environment. It's going to be absolutely vital.
Thank you. Now, Simon talked about the mess we're in the sector. By way of closing, I just want to ask each of our panelists whether they think that the shock to the system that the COVID crisis has brought in the last 12 months is going to get us over the hump and deliver the fundamental reform we've been saying has been in the air for so long but has never appeared. Becky, what's your sense? Do you think this is a game-changing moment?
I think it's definitely kind of brought everything into sharp focus, really, definitely. Whether it's going to be the game changer or one of many factors, probably that. It's a real cliche, I know, but I do believe it's not what you do, but how you do it. And in terms of relationships, I really believe that the relationship based practice is the best model for social work and social care. But actually that analogy is true for working between professionals, between social workers and care providers and our partners in the NHS. For me, we're going to deliver best outcomes for people when we talk to each other, when we are prepared to share resources, when we look at sharing things around reflection and peer supervision, that type of thing, when we work together to understand the needs of the local population and how we can work together to deliver that. So yes, for me, I think that the crisis has probably accelerated or just brought into more relief the kind of acuity of those things.
Thank you. Simon, do you think this is the moment? The 1948 moment, as people are...
Yeah, I mean, potentially. I mean, we've never had a better demonstration of the argument for state intervention into the market economy, have we? I think we do need a kind of vaccine, don't we? We need our own social care vaccine. That's what we need. But I think it's going to take the likes of the Open University and other educators and also national representative bodies of the sector to come together to continue to argue for a social care solution. I mean, they have mentioned something, or they've leaked something, haven't they, about some restructuring of the NHS with some mention of the social care in there. I think they're just testing the water with that at the moment. But they, again, for some reason, they're scared to touch social care directly. So I'm still rather cynical, David.
Sam, are you cynical?
No, I'm not cynical. I'm optimistic because I think there's a momentum gathering that I've not experienced before. And that momentum is evidenced by all the different stakeholders coming together and forming a coalition. So we now have a social care coalition. We have cross-party support politically, both in the House of Lords and in Westminster. That suggests something is moving forward. The question is, it's about taxation. And I believe that we would be there once government settles the taxation issue and what method of taxation it's going to adopt to bring about changes in social care and have that investment. And that will be a political decision, and it will be politically timed.
Thank you. We've been talking about charting a path forward for social care and social work around this new Open University report. Sam feels there's a real momentum out there, and I go back to one of Simon's first points when he said, you know, his organisation has never felt more linked in to the health and social care structures in the Southwest. So I think there are those real seeds of hope out there at the moment, and we have to build on the momentum as Sam said. But let's remember we've had too many deaths of social care workers over the last 12 months, almost 500 between March and December alone. There'll have been more since, and it will be a fine tribute to their memory and to their loved ones if we could deliver the transformation of social care that we've wanted for so long. Thanks to our panellists for joining me, and thank you too for joining us today for I hope what has been a very interesting debate. Bye-bye.